regulated by the Uganda Communications Commission.
Yes, a very beautiful morning and welcome to the Coffee Break Conversation. My name is Rita Nandira and it's always a good pleasure to see you watching the Church of Uganda Family TV. Probably what I can give you a brief information about what we are going to discuss about. The Uganda's Ministry of Health report revealed that around 61% of both the children and adults are suffering from some form of the misalignment of the teeth. And while the overall prevalence appears consistent across the age groups and the severity of these conditions varies significantly by the district. In some areas, moderate to the severe cases affect between 6 to 14% of the children and 3 to 5% of the adults. So we need to understand more about this and what it means for Ugandans today and how can we be able to address these dental challenges. And next to me, I've been joined by Dr. Mulwana Ronald. He is from Mengo Hospital, the dental department, and he'll be able to give us more of the information we need to know about this malalignment of the teeth. Happy to see you, doctor.
Good to see you too.
Good morning.
Good morning.
It's a good pleasure to have you.
Yeah, thank you so much.
Amen.
Yes.
So basically, to kick off with our conversation, where is this the misalignment of the teeth? What is core foundation? How does it come about?
Yes, thank you so much. Malalignment, sometimes it's called a malalignment treatment. Sometimes it's called orthodontic treatment in our language.
Okay.
And there are so many causes of crooked teeth, teeth that are not in line.
Yes.
It is mainly a space problem in the mouth.
Okay.
If there isn't enough space in the mouth, you can get some teeth blocked out,
Okay.
some teeth rotated, and sometimes it's due to a jaw problem. If someone's jaw did not grow so well,
Okay.
you can have that malalignment of jaws. So malalignment is not only to do with teeth,
Okay.
someone's face, the jaws and the tissues around. So it's a big area, it's a big picture concerning teeth and the surrounding tissues. So someone can have a problem with their teeth or someone can have a problem with their jaws.
Okay.
For example, if you look at some families, they have got an inclination of their upper jaws being a bit ahead.
Yes.
Like someone's jaw goes ahead of them, and the teeth follow the jaws. So there are so many things to consider when we talk about malalignment. Yes.
Like being a doctor, how many so far, can you able to give us the percentage, how many Ugandans are affected to this?
Yes, the percentage, maybe we could say about in the books from the research.
From the research, yes.
Yeah, about 30% to 40%.
40.
Yeah, those that have come and been checked.
To the hospital?
Yes, to the hospital. But there are many out there. So we cannot rely on the 30%. It could be bigger than what we know. Yes.
And what is the majority? Are they the young children, the adults, or even the old? What is that alignment?
Yes, malalignment, usually we find it in children. But sometimes if it is not corrected, of course you will find it in adults. And mainly we want to catch it early. That's why we emphasize, checkups, early treatment. You come to the hospital if you're a parent as early as a child is 2 years.
2 years.
Let them come for a checkup, just dental checkup. It may not be malalignment checkup or constant, but a dental checkup. Because if these problems are captured early, the better. And the simpler the treatment and the quicker, and the better the results.
I think the 2 years is kind of early.
2 years is mainly for dental treatment. Dental treatment.
And how can parents be able to know that my child could be having maybe trying to the crest? Because I believe most of them do not consider that. They take them maybe for other things, but for the dental such kind of checkup, I think it's not mostly in their minds.
Yes. Now, usually permanent teeth start coming at around 6 years.
Yes.
So maybe if you notice some positioning of teeth, you know, when you're a parent, you become sort of an expert of sorts of things, you know. Yes. You're a doctor, you're this, you're a teacher. So now you as a parent, you can check your child's teeth, and if you notice any strange thing, you can come to us. You can come to any dental, expert, and seek their consultation, seek their opinion. So as early as 6, the 2 years is mainly for dental, but usually 6 years you can come for an ortho consult, a malalignment consult, and then the doctor will advise you. Yes.
We help people who could be in villages. How have you tried to reach out to them to be able to understand this particular?
Yes. It's a challenge. Healthcare, and people in the rural areas accessing healthcare, and this being a specialty, usually. It is done in these urban areas. So it's still a challenge, and maybe the powers that be, can try to help out, but usually we find this treatment in urban areas. But of course, yet it affects even those in the rural areas. Yes.
So, being that they have challenges with getting the services, with the medical care services, now what is the way forward? How? Because we believe that if you intervene, maybe there's some support that is given. I don't know, how is, for example, Mengo Hospital in line with that? How have you reached out to these particular individuals?
Yes, as Mengo Hospital, we sometimes do outreaches in those hard to reach areas. So we go and render healthcare, including dental treatment. So just even an examination, and you let the parent know there is this problem, and also you advise, because when we go back to the causes, sometimes a cause can be finger sucking.
Finger sucking.
Yes, or tongue thrusting. Yes. Usually finger sucking that goes beyond 4 years is likely to cause problems. It may be normal below 4 years, but usually if it goes above 4 years, it is likely to cause some sort of malalignment. It can cause a space here at the front, and then the teeth at the back get squeezed in, they get disorganized, what we call a posterior crossbite in our language. So these early interventions, telling the parent to encourage the child not to suck their finger, can help. But since this is a specialty, there are some things that you cannot do in the the village, and you need to come to a setting where there are machines and instruments to
What are the outcomes of this if not early intervened? Give us a few of the major outcomes that may occur.
Yes, and now if a child is not, if their teeth are not aligned well, first of all, it affects their self-esteem. Have you seen some people when they are smiling, they smile like this because they are not confident. And at an early stage, you want your child to be very confident, ready to face the world. So self-esteem, it affects their self-esteem, and also it affects the personal hygiene, the oral hygiene. They cannot brush those teeth that are very disorganized. Food gets trapped in between those teeth, and it can cause even the other teeth to fall sick. It can cause cavities. Remember, cavities are brought about by food getting trapped or staying on the tooth surface, and if it's not removed, that's where the problem begins. So when we align these crooked and disorganized teeth, we are trying to create an environment that is cleansable, that someone can easily clean, and we are trying to improve someone's oral hygiene. So if they stay disorganized, you're going to get a problem of oral hygiene, and then when this problem comes with caries, you can get cavities, people can lose their teeth. So when we align their teeth, we alleviate that problem. Then the other problem would be some people, if their teeth are a bit far forward, they are likely to get accidents quickly. They are positioned in a way that they are prone to getting, if they get knocked, those teeth easily get problems. They get knocked because you've seen some people's teeth like this. So if they fall, yes, it's the first to hit the ground. So when we align, if the tooth was like this and we align it, so we are trying to reduce on that chance of them being prone to accidents. Yes.
So how have you tried to, because now I'm trying to bring out that picture, if they have not been aligned properly.
Yes.
So far, if I'm an adult now, is there any way you can be able to deal with that thing, or it becomes too late?
No, it's never too late.
And how do you do it? Because we need to get this picture, and the viewers who are watching this.
It's never too late until you're in the grave.
Amazing.
So we've had a patient who is 60 years come.
60 years.
Yes, they come for treatment.
Okay.
So it is never too late. So you can still walk in and get expert help. Tell the doctor, I don't like the way I look. In fact, there is a girl. Their parents were not financially stable, and she said, when I get money, I'll make sure I go and correct this. And after campus, she was able to get a job, and she came to our practice, to Mengo Hospital, and were able to work on them. So it's never too late to correct a problem. So yes, even if you're 60 years, 70 years, something can be done. Please, you're welcome to have a good smile, improve your smile.
Now, on your part as doctors who are more experienced with ensure that you align these things well, how do you do it? Isn't there any side effect after aligning these teeth for these adults, most especially? For the young, it may be understandable.
Yes.
Now, for a grown-up person who's 60 years old, 70, are there any side effects that occur after the whatever thing that you do, your treatment?
Yes, thank you so much. Now, let me first talk about the whole process. The process, of aligning teeth. Now, what we do, there are some. They are called braces or brackets that we put on the teeth surfaces. The metals. Some people may call them some sort of luxury, bling bling. Exactly. And if someone sees, especially if they are teenagers, if they see their friend, with I want also that. Yet it's actually treatment. So we use those appliances to gently move the teeth into position. And not only that, sometimes we use other appliances, like for example, if a child is still young, there are some appliances that we use to take advantage of their growth. Like if the bone is still growing and it's growing too much, we can either prevent we can decelerate the growth of the bone, or we can accelerate, encourage the bone to grow more to cover up for the malalignment. So we put those things in the mouth, the metals, to try and correct. Now, when we put those things in the mouth, that means if you eat food is likely to get stuck on your teeth. That means you have a higher chance of getting caries if you don't keep very good oral hygiene. So it is not just fancy treatment. It comes with the responsibility. And that's why many times we start treatment at about 12 years when the child can be able to brush very well. But sometimes we start treatment early, depends on the case. So yes, you have to brush very well. There is limitation to the things you eat. You cannot just grab things and pull them. You may remove your braces, and that is an expense to your parents or to your pocket. So there are limitations that you have as a patient on what to eat, on how you brush your teeth, how many times you brush your teeth. The chewing gum, you cannot chew chewing gum if you have braces in your mouth. So these are the things that these are some of the limitations. But if you are an adult, it it is case by case, assessment. Yes, because some adults, they have got some bit of gum disease. It may be a bit of a challenge. That you have to first arrest the gum disease, first treat the gum disease before you do the braces. So the expert will assess your condition and give you personalized treatment depending on the case.
But to take you back on some statement you have mentioned,
yes.
When it comes to those metallic things that you put,
yes.
Which kinds of foods are not acceptable, and which kind of drinks? I remember one of my friends saying that she's not supposed to take a cold things, this hard food.
Yes.
So she's more of eating Irish. I don't know which kinds of food. Someone could be out there.
Yes.
Maybe they want to come and the same things that they see in their colleagues.
Yes.
They come. What are those the food stuff?
Okay. Yeah.
And how much does it incur for this?
And now some of the foodstuffs that we encourage our patients to avoid. Usually they are hard foodstuffs like hard corn, popcorn, crisps, sugar cane, cassava, things as hard as those ones, even ground nuts, chewing gum, things involving pulling. If you to eat meat and you're an ortho patient or you're a patient that is aligning their teeth using braces, you cannot just pull on any bone. Your meat should be soft and cut into small pieces. You don't stop eating meat, but it should be soft and cut into small pieces. You don't want anything that will pull off the braces, Yes. So any foodstuffs in that category, that is hard, hard corn, as I mentioned earlier, popcorn, crisps, avoid those foodstuffs. Sugar cane, chewing gum, but drinks, there is no limitation to drinks. Yes, it's mainly to do with foodstuffs. The hard foodstuffs. Yes.
And the cost? How much does it cost for that?
Yes, now orthodontic treatment or treatment to correct malaligned teeth is a bit expensive. Yeah, exactly. So usually you go and they assess your teeth. Actually, why it may not be accessible to those in the rural areas, because this treatment is expensive. So you go and they assess. They have to take x-rays. Sometimes we do 3D x-rays, we do these normal x-rays. They have to take your measurements, and then the braces themselves, the whole process, it's a bit expensive. But for you to get the cost of the actual procedure, you can only know when you consult an expert, and they let you know the cost. But the good thing is with this treatment, in many of the dental practices, including Mengo, you don't have to pay the whole amount at once. You pay in installments. You first do the first installment, which usually is half of the cost, and then because we see you once every 6 weeks. If you are in boarding school, we may see you like 3 times in a term, so that you don't miss school. So each time you come to visit the dentist, you come with some money to reduce on your balance. So that is a good payment plan for our patients. Yes.
And for how long does this take?
Yes.
The period of time for these teeth to be aligned well. And the patients who are victims to this, what advice do you tell them to always visit the hospital every week or monthly? How is it?
Every week, if I don't have time. How is it? But thank you so much. Yes, this treatment takes a bit of time depending on the case. There are some cases that may take 6 months.
6 months.
And there are some cases that may take 5 years. Wow. There are some cases that may take a year. So it depends on your case. There are some cases that may take 2 years. So it depends on your case. But usually treatment takes between roughly 2 to 3 years on average. So someone can have those braces in their mouth for that long. Yes, and then what was the other question?
And how do you guide them to be coming back for the checkups?
Yes, after treatment, there is what we call retention.
Yes.
After aligning these teeth have a tendency to bounce back to the old positions. Yes, they have that tendency. So after this treatment, usually there are some appliances that we give to patients. They are called retainers.
Okay.
Yes. So depending on your case, the doctor will select a retainer that fits your case, and you have to wear that retainer for maybe 1 extra year. Sometimes we begin by wearing the retainer 24 hours. Then after that, doctor will tell you, now you wear the retainer at night. And there are some cases where you wear the retainer for the rest of your life. It's called permanent retention. Retention. So it depends on the case. Yeah, but usually you are advised to come once every 6 months.
Every 6 months.
After treatment, for the doctor to see, have you been putting on your retainer? How are the teeth? Are there any other problems?
Yes.
Yeah.
Okay, it's interesting, and really we are so much interested in this. Is there any other treatment besides that? Someone doesn't want to have that metallic thing in there. What else can you go to use? And
thank you so much. Apart from the braces, the metallic things, there is what we call Invisalign.
Invisalign.
Yes, there are special trays, and this one is by specialists that are made for you to wear. Yes. There is also that. Then there's also they are called lingo braces. Now those ones are put instead of them being put outside on top. They are placed inside, on the inside surface of the tooth.
The behind?
The behind surface of the tooth. Yes. And that, though those ones are more expensive.
Which one are better? Yes.
No, it depends on your pocket. Yes. So it depends on your pocket and your liking. Yes, but of course, they are called lingo braces. They are more expensive than these ordinary ones that we put on the surface.
Should you say they work more faster and they're more preferable than the normal ones? Because the majority, we have seen them with these on top and the behind part. Actually, it's my first time hearing that even those ones which can be put behind. It's interesting.
Yes, now in Uganda there are few specialists.
In Uganda.
Yes, in this kind of field. And those lingo braces are done by specialists. Yes, people have taken extra time to study this field. That's why you see there are very few people with them. And also they are a bit more expensive, but they are available.
They are available.
Yes, they are available.
We have them in our hospitals. Maybe you have.
Yes, we have them. Yes, we have specialists.
I thought there was since you have said that a few specialists who can handle that.
Yes, answering your question why you do not see them commonly, it's because they are done by, first of all, specialists, and also they are very expensive as compared to these ordinary ones.
You just said there is a gap. If there are few specialists who are handling that part, and yet the majority of Ugandans are being affected with this, the tooth misalignment. There was a very big gap.
Now, the very interesting thing about orthodontics, or the process of aligning teeth, is that there are cases that a general dentist can handle, and then there are cases that specialists handle. So the general dentists, at least we've increased in numbers, in our country. So at least to cover up that gap, so that our patients are able to get this treatment. If there is a case that is a bit tricky, that is for a specialist. But usually these are normal cases that can be handled by general dentists.
Okay, nice. All right, let us get into a quick commercial break. We'll be coming back with Dr. Ronald with this conversation. I believe you are sending in your questions on the YouTube channel. We are live. And of course, the WhatsApp number for Church of Uganda Family TV. Any question you want to ask the doctor, we'll be able to get back to you. Stay tuned on the coffee break conversation. Let us come back.
This is Church of Uganda Family TV. Enriching lives. Regulated by the Uganda Communications Commission. This is Church of Uganda Family TV. Enriching lives. Regulated by the Uganda Communications Commission.
Okay, welcome back from the quick commercial break. We are still with Dr. Ronald from Mengo Department of the Dental, and we are talking about the misalignment or malalignment of the teeth in us, the Ugandans. And the first segment, I think you have had most of the information you needed to know. So, Doctor, what is Mengo Hospital doing? Are there any programs or partnerships to support these low-income patients when it comes to the need of the medication of the misalignment of the teeth? How is it doing about it?
Yeah, thank you so much, Rita. Mengo Hospital, invites every patient. You come for your consultation, and then, like I said, we have a good payment plan.
Yes.
Usually, if you to have treatment in Mengo Hospital,
Okay.
you'll pay the first deposit, which is half of the cost, and then you pay in installments, because we say treatment takes time, from about 6 months to 3 years to some cases to 5 years. So we have a payment plan.
A payment plan.
Yes. Yeah.
When it comes to the treatment, as doctors and specialists in this field, have you encountered some challenges when carrying out this activity?
Yes, there are some challenges that we encounter. Like as I mentioned earlier, oral hygiene is very important, and if someone has braces, they are supposed to, be extra cautious and careful and committed to a very good oral hygiene practice, taking time to brush their teeth well. Because if you give the child braces and then they have very poor oral hygiene, the teeth end up falling sick, and the problem becomes even worse. Yeah, so we have a challenge of oral hygiene, and we train our patients, but sometimes you meet those ones, one or two, in 100. And then the other challenge is motivation. Okay. Sometimes a parent can come, the parent is very motivated, but the child is not motivated. The child is not yet seeing the problem.
Yes.
Yeah, so we encourage the parents to talk to their children first. And if the child is not motivated, they are not going to follow instructions on what to eat. They are not going to brush their teeth well. So you're going to end up, every other time they are removing the braces that you placed. So motivation is key, and it goes back to the parent. First sit with your child. And sometimes if the child is not motivated, we cannot, do the treatment. So we refer the treatment to when they have grown, and they're maybe teenagers. Now they're a bit sensitive of the way about the way they look. Now they are more motivated. They will follow the instructions. Yes.
But the earlier the better.
Yeah, the earlier the better. Sometimes the other point is, as a parent, there are some teeth that at a certain age, they're supposed to be out of the mouth.
Which
yes. That's why I said, a checkup, for a child, a checkup once every year, especially if the permanent teeth have come. Like we said, around 6 years. So every year you can let the child come for a checkup, and we see, because problems to do with malalignment sometimes are caused by retained baby teeth. If the baby teeth is retained, the baby tooth is retained, and this other wants to come in that space, it finds there is someone, so it is more likely to get displaced, to get disorganized. So if we see that early, we are able, to remove this retained baby tooth, and then we save you of the other money of aligning teeth.
Yes.
So that's why checkup once every year for a child above 6 years is good. Yes.
It's really important. And have you tried to partner with some entities to ensure that this thing is really dealt with a certain way? As Mengo Hospital.
As Mengo Hospital.
Besides working within you, and have you made some partnerships to ensure that that area is worked on when it comes to the finances,
Yes.
funding, when it comes to that.
Yeah, that is in the process for
It's
now.
in the process.
Yes, I cannot say this and this, but it's in the process.
But-
we are trying to get some partnerships here and there.
Some partnership.
Yes.
To see that more money is invested in.
Yes, for those that are less privileged,
Yeah.
such that they can be helped. Yeah, it's in the process. Right now, I cannot say we have this and this. Yeah, but the partnerships, we are working on them.
Okay.
Yes.
Now, other parents, we have told them this information, but I think the picture is more needs to be made more clear when it comes to the saying, mostly for the young child when they're growing up. And because I know some parents can go to the hospitals and they do some little bit of quick checkup because that's what you have told them. But initially, which specific sign can you able to tell them that maybe if this appears, just get to know that your child needs to go for immediate the limit to the treatment briefly.
Thank you so much, Rita. Now, usually, like I said, around 6 years, that's when permanent teeth begin to come up in the mouth.
Yeah.
And as a parent, if you notice there is another tooth growing behind the other, and the baby tooth is still there, sometimes, like I said, a parent, you must be an expert of so many things.
You should be able to stand by to know what is happening with all. Basically, there's some changes that come across. I don't know how you people do align this.
Yes, there's like I said, you said about signs. Like some parents may not even know these things.
They can't know.
Yes, that's why I said you come for a checkup. Let the child come. If you notice anything strange, or even if you don't notice anything, let the child come 6 years. If they have never come to a dentist at 6, let them come for the first checkup, and then from there we can advise you. Yes.
The second tooth that grows from behind, how do you usually pluck it out, or is how you deal with it?
Now, usually the tooth that grows inside is the permanent tooth.
That grows inside.
Yes, inside.
Inside, okay.
And usually the ones that grow outside are the baby teeth. So if they are retained, the other one will continue to be inside, or it will generally get disorganized in terms of not being in line. Yeah, so that's why these things are important. Take the child to a dentist or an expert, a dental expert, and then they will advise you.
So for how many patients are you handling? Do you have any? Is it daily? Do you always have new patients with these cases daily, or is it on a monthly basis? The records that you have as Mengo Hospital.
Yes, Mengo Hospital is open every day from Monday to Sunday to receive patients. All sorts of dental patients with all sorts of dental problems, not only malalignment. So we are open from Monday to even Sunday. We opened up the Sunday clinic to make sure we serve our community better. So these experts are there every day.
Every day.
Yes. So there is no excuse for your child to walk around with a crooked teeth, or for kids to mock your child, or for your child not to have confidence when these treatments can be accessed.
Is Mengo Hospital 100% having the capacity to handle these kinds of patients dealing when it comes to the dental teeth? Majorly that is the capacity of the staff more than enough. That's why I was asking, how many patients, how many victims of these kinds? I may not be about the malalignment, but of course when it comes to the issues of the teeth problems, how many patients do you receive, let me say, per day? Are they the majority? We want to get that report quickly.
Okay, Mengo Hospital Dental Department, we are over about 15 dental specialists,
15
dental experts that are ready to receive you every day. Of course, there are different specialties, but any dental surgeon or dental expert will receive you and would advise you accordingly. So every day, in terms of the cases that we receive, you may find maybe in 10 patients, you can receive two that have this problem of malalignment. Or you can receive about in 10, about maybe 4 that are not aware of the malalignment when they have come for other issues. And then you let them know. But as I said, motivation is very key. if someone is not aware of their problem, they are not going to follow instructions to do with the treatment. And we say there are limitations to do with this treatment. Yeah. So some people, they are just not aware of how bad their teeth look like. Yes, exactly.
They
They
are comfortable.
are comfortable. And you can't force this treatment on people. Yes, they are very comfortable.
Yes.
Yeah. So we receive maybe about 20%.
20%.
Yes, of our patients.
Patients.
Yes. Yeah.
Weekly or daily?
No, daily. Yes, yeah.
So at the end of the year, the majority, okay, we want to have an overview
Yes.
of the whole report. Which percentage can you say that by the end of the year, maybe you say patients of the teeth problem have been at this percentage, maybe more than for this, and this, because I think it's the problem that we usually face in our country, Uganda.
Yes, mainly, our health-seeking behavior here is to do with pain. If someone has pain, that's when they will go to a medical person. If someone has tooth pain or gum pain, that's when they go to a dentist. So the percentage of people who come maybe for this malalignment problem, like I said, about 25% if it's too high, 25%. The other percentage is to do with pain.
Yes.
I have a tooth problem. Maybe they need some sort of treatment, some sort of filling or root canal. That percentage is high. But this percentage of, hey, doctor, I don't like the way this tooth is looking. Maybe I don't like the way I'm smiling. That one's a bit low. Because maybe some people view it as some sort of luxury. Yes, in our country. Yeah, so the percentage is a bit low.
Okay. All right, as we're winding up, maybe you can give us your last a few remarks when it comes to this. And maybe the public out there now has gotten a picture what they need to do as early as possible. Unless if someone is comfortable with the way how the thing is, but kind of your last remarks. Put for them that picture and tell them the benefits of this.
Yes.
Maybe.
Thank you so much. Yes, orthodontic treatment is for everyone as long as you have a problem and you believe we believe something can be done. Yes, do not stay out there thinking that your problem cannot be solved. There are people have trained for these problems, and we encourage you to come for a check. The first thing to do is come for a checkup. You come for a checkup. There are experts, like for example in Mengo Hospital, who will receive you with open arms. We have a team that will handle you very well. Maybe the other remarks I can say. It is not to do with this malalignment, but it's to do with just teeth. Yes. Something strange happened while I was working, maybe last month. A child knocked their teeth and they came out. And then usually parents do not know what to do. Even some people, maybe some people do not know what to do if that happens. I felt I should share this. So if you're a parent and your child knocks their front teeth out, what you can do immediately is to try and put them back in the mouth. If you cannot do that, you put them in normal saline. You can go to the pharmacy and buy normal saline and rush the child to a dental, expert to receive help. Because otherwise the child lost, we are now thinking of replacement. Yeah, that is very important. I felt I should share that, And then the other thing is, like I said, motivation is key. Parents, if you want your children, to get the best out of this treatment, you must sit down and counsel them and tell them the advantages. We as the experts, we will not be able to treat this child if he's not motivated. But otherwise, this treatment is available, and the good thing is that you're able to pay in installments. Yes, we know it is expensive, but there is a good payment plan. For example, at Mengo Hospital Dental Department, we'll receive you and we'll give you a very good payment plan. Amazing.
Yes. So you haven't mentioned the figure, if it's 2M, 3M. we just put a picture about that figure.
Yes, as I said, you know, come.
Okay, the affordable, the least affordable.
You
we
come for a
need-
consultation, and then you'll get all those details. Yes,
I'm here. I think I'll come and I will see the way forward to do this. But thank you so much.
you're welcome.
For that wonderful information. I think we'll be able to do this every Tuesday to see that we carry out this initiative to see, besides the department, for the data department, of course there are so many other departments which could be having more the information
Yes.
that the public needs to
Yes.
know. Yes, it has been Dr. Ronald from Mengo Hospital, and of course my name is Rita, and allow me to wish you a blessed Tuesday, and let's meet the coming time. Bye bye.
This is Church of Uganda